This is the Beyond the Prophy podcast, the podcast that empowers you and inspires you to seek career excellence while pursuing your passion. And I'm your host, Jasmine Haley. Hey BTP family, thank you so much for joining the show. As a high-achieving professional, we have to remember that we should never stop learning. And that's why Beyond the Prophy offers the best CE that you can take from home or live in person. If you go to www.beyondtheprophy.com, under our events tab and under live CE webinars, you'll see a host of topics we cover, such as air polishing, working and managing the autistic population, medical marijuana, periodontal endoscopy. The list goes on with what we offer so that you can provide the best care for your patients. Beyond the Prophy has taken the time to become AGD PACE CE provider and an AADH CE provider. So stop on over, come on and learn with us. We can't wait for you to join us. We will continue to serve you with excellence and we'll see you next time. Welcome to the Beyond the Prophy podcast. I am very fortunate today to have a special guest. We have another dentist here on our podcast, and I'm very excited to share with you listeners the work that he's doing, to learn about it also myself, and to talk about some of the things that are necessary as clinicians. We want our patients to be as healthy as possible. So I would, but I am going to give a very warm welcome to Dr. Thomas Larkin.
Thank you so much, Jasmine. Absolute pleasure to be here. I got a lot to visit with you about for sure.
Yeah, I can't wait. So what's very awesome, right before we get started, I had to ask what his acronym was for what he is doing, and it's called Proactive Oral Wellness.
Correct.
POW Hygiene.
Correct.
So tell me a little bit about that for our listeners and for myself also.
It comes back to that whole concept of preparing for health instead of reacting to disease. You know, dentistry forever has been set up that we react to disease. People come in and they have damage, they have holes, they have infection, and we react, right? And so prevention is about preparing people for health, and it's a whole different mindset. And, you know, I've had the great blessing in my career to have great mentors, and now I'm passing along my passion for prevention in a huge way. And we can talk about some of the things that I'm doing. I just came back from an awesome event this past weekend where I was involved, and we did a screening and we saved a doctor's life. And so we can talk about some of that stuff.
Awesome. Well, tell me about the event. Where were you at?
So earlier this spring, I've really gotten into implementation phase. So I have an online course for oral systemic training. And some of your audience is probably familiar with the Beyond method. There are a couple of physicians who developed a cardiovascular prevention program that involves dentistry. They need dentists to do various screenings. And so I became a patient of Dr. Bales in 2013, and that's where I've kind of developed my model is a medical/dental model. And so I hooked up earlier this year with one of the top Vale Doneen practitioners. Her name is Dr. Gina Pritchard, and she is located out of Dallas-Fort Worth area. And I had an event here in Lexington. It was an open house for a preventive medical clinic. And it was a project that I had for a couple of years. I sent a physician friend to get trained in the Vale Doneen method, and we finally got around to opening this clinic. And we said that we're going to do a medical dental collaboration and have a joint screening. And instead of opening up to the public, I said, let's just do some docs. You know, if we don't get our healthcare practitioners knowledgeable and healthy. So we did 8 dentists, a nurse, a hygienist, and 2 physicians. And we put them through the methodology. And, you know, if you got time, we can kind of talk about what that looks like.
So I love that you are doing an interprofessional collaboration. One of the positions I have is an educational consultant for the University of Maryland School of Medicine. And I have a wonderful, unique position, especially as a dental hygienist, to be educating future professionals, future physicians, pharmacists, nurses, social workers, dental hygienists. Who else do we have in there? We have law. All of these professionals together on HIV and Hep C and how we can work collaboratively together in combating that. And I think it's a way of the future. It's something that we've constantly have talked about. It's necessary that we collaborate and work with our medical professionals. But there's so many professionals out there that feel at a loss because they don't know where to even start.
Right.
So what would you advise for someone, especially for those who are listening, like where to even start with that? And then I want to go back to Bale Donine because I've heard of that. I've never read the book. I saw the book.
Yeah, the book is The Heart Attack Gene. Is the book.
Yes.
And if you pull it up on Amazon, my book is right next to it. You know where they recommend? I've got a book on prevention called I'm Free. And it says also, kind of an anecdote. So the Bale Donine method is, and this is kind of in a nutshell, it's a cardiovascular prevention program that begins with a CIMT ultrasound, a carotid ultrasound, where you look at the health of the carotid artery. We're looking at, for the health of the artery, presence of inflammation, presence of soft plaque, okay? So we brought in a technician to do that analysis. And then it's a very comprehensive blood panel. Cleveland Heart Lab and Boston Heart Lab both have a very comprehensive inflammatory panel, okay? So we want to look at the health of the arteries. We want to look at insulin resistance, you know, just a complete metabolic panel. And then from my standpoint, I did a biofilm screening. Now I use a chair-side phase microscope, and I'm going to talk about that in a minute. Then we did the biofilm DNA. That's the DNA test that you send to the lab to look for pathogens. Then we did a sleep apnea screening. And the last part is the endodontic, silent infections associated with root canals. We did a screening for that. So that's kind of the entire Bale Donine methodology. And the theory is that if you can address every potential source of inflammation, and Dr. Bale and Dr. Donine feel as if the mouth is as much a 50% contributor to overall inflammation in the body. That's why they're dentistry's best friend, is because they're focused on dentistry, even though they're not dentists. They've learned in the past 15 years that whenever they get a situation they can't figure out where something starts, they go back and they look in the mouth and they inevitably find a source of infection. Okay.
Yeah. I've gone to Thomas Ram's course, and I've also been trained on how to use a phase contrast microscope.
No, that's unbelievable.
Yeah. So I'm fully aware of that, but I'm not in clinic. I'm not a practicing clinician anymore.
Okay. You'll love my story because I was trained by Paul Keyes, who's Thomas Ram's closest associate, Dr. Keyes.
Oh, wow. Very cool. Very cool.
He passed away last year at the age of just right at 100, 99. And I was in communication with him until the very end and about my course, because what I've done is I've revised phase contrast microscopy. So what I did last year when I was developing this course, I was using the old, quote unquote, old school microscope, which the technology there had not changed. And I knew it needed to, because that instrument's cumbersome and it's hard to do a consult. It's hard to set up. And I found a guy last year who listened to me. He's in the microscope business for 40 years. In fact, he had mentioned Thomas Rams because this company's in Philadelphia, and they developed a plug and play. It doesn't have any eyepieces. It's very compact, fits chair side. The coolest phase microscope you've ever seen. Okay, and they developed it for me. Then my world changed, because from that point forward, I'm able to do virtual consults over Zoom. I can have people buy the microscope, and I can put the entire program in over Zoom. And I've been doing this since the first of the year. And I'm telling you, if you've got experience with it, you know it's a game changer. But the problem is, it's a difficult, the old-fashioned instrument with the camera screwed into the top. You know, it doesn't fit very well in the operatory.
No, it doesn't.
You can't. It's hard to put. Anyway, this thing is like short and squatty. It doesn't have eyepieces. I carried it in, I went to Dallas this weekend, threw it in my luggage. I mean, I couldn't do that with that old microscope. The camera on this is internal. It's an internal camera. It's got Wi-Fi. You can do it on the iPad. You can text the fields that you see. It's incredible. So from a technological standpoint, that is the game changer that has changed everything for me. And so with you having experience, I cannot wait to show you this. I'm gonna give you the link and show you, because I've developed a whole course and revised that, because I think that's the introductory. This is what I told Dr. Bale when I met him. I said, you're going to have problems with this oral systemic conversation, getting people to the biofilm DNA, which is a non-insurance covered procedure.
Yes.
150, $200 if you can't lay the groundwork for the microbiology. Okay. So there's nothing as instructive as the video phase microscope, nothing. And so
I agree, because it was that through what we had it implemented into our actual protocol. And so initial patient would come in, I would take an assay. Now I've worked in 2 different offices where one was like, they did it minimally only at the very beginning. There was one that they were frequently checking it.
Right.
Anytime there was any type of issue. And anytime you've had a patient that was dealing with any type of inflammation, a lot of times people will come to you and say, oh, well, bleeding gums runs in my family. And they've always bled. And when they actually see the source, when they see spirochetes or that amoeba crawling around in there, they're like, what in the world? Get it out.
Exactly. So what are you going to do about it, and when are we going to get started? Those are the 2 key phrases. And I tell dentists that, and I tell hygienists that's the magic moment. So man, I'm so excited that you've got that background. You will absolutely love what I'm doing, because so we do this screening here. This is in March, and then this past weekend I went to Dallas to a major laser conference for Photona. And it was a combination of, I got to speak about the oral systemic connection, and we set up the same screening. I had the microscope, I had a hygienist with me, we were doing the carotid ultrasounds, and it was, the people lined up. We did 94 doctors. We screened 94 doctors. If you can believe that they had the interest to sign up and go through the screening. And when I tell you, we saved somebody's life, we did an ultrasound scan on somebody that his carotid was completely blocked. It was completely obstructed. I mean, he just could have, he needed immediate medical attention, and he didn't have any symptoms.
So what does your screening consist of? Because so for me, what I'm hearing from you, what I hear is that your target audience are not only the practitioners, but to also empower the practitioners to then give a more comprehensive care to their patients. So what does your screening consist of when you go to these?
So this is a work in progress, and this is a trajectory that, I'm involved with people that are leading this thing. Okay. So Dr. Pritchard actually has training hygienists how to do carotid ultrasounds. Okay. Now, I see this now. This is, that's absolutely cutting edge. So basically what would happen is you screen a patient, they've got perio, you've identified them at high risk, they've got underlying medical issues, you test for pathogens, they've got pathogens. The next part of the conversation is, you know what, I would really like to look at your arterial health. It's an inexpensive, non-invasive test. It takes 15 minutes. I'm going to scan your carotid arteries. We send it off to a lab. It's not read chairside. It's got to be professionally read. Mm-hmm. And then let's see where you're at from an inflammation standpoint, and plaque and soft plaque and whatever. And then we need probably to engage the services of a physician who is preventive oriented. Okay. So this ultrasound becomes the bridge. And so what's happened in the 2 events that we've done, with me doing oral screening and Dr. Pritchard doing the CIMT screening, it's a natural marriage, because it's non-invasive. It just takes a few minutes, and it's very reflective. So you love this. Okay. So our audience was exclusively medical dental, right? Mm-hmm. We had the highest ratio of spirochetes, everybody, almost everybody. And also the carotids with soft plaque, with risky plaque. way above average. Okay. And she was asking me, she says, anybody done any research? She goes, I know dentistry is like, it's a stressful occupation, blah, blah, blah. But I said, you know, there's a lot of exposure with ultrasonics and misting and stuff there's a lot of exposure in the profession to pathogens. And hygienists are very susceptible. If you had a microscope and you saw it, you would use a full face mask when you did an SRP. You would.
I do anyway, but I'm also, because I'm used to working with infectious diseases.
Yeah.
Like, I know what my patients have. Whereas people who come, there's a difference between someone, like for me, my background was public health, working exclusively with patients living with HIV or Hep C.
Right.
So I was always, I kept the same type of, like I was in school. I kept that same asepsis technique.
Right.
But people that get into private practice, because they see, that every assessment that comes in for their patient or is a clean bill of health, they just automatically assume by the way that people look. But I totally agree with you. I am like someone that is very, very, very big on that. But I think what I want to make sure that we provide value for the listeners of this podcast is understanding, where do they even start to do that? Because I hear what you're saying. That's not a surprise to me. As dental professionals, we have so many professionals right now that are burnt out. They're not taking care of themselves.
Yes.
Many of them feel like they want to quit our industry, but I really think the source is because they don't do any sort of self-care at all for themselves, mentally, physically, spiritually.
Sure.
So I'm not surprised in hearing results like that. But for the hygienists or dentists that may be listening, where do they even start? How can they even get involved with something like this and be able to integrate that?
Yeah. So basically what I've done, and you know, you can talk to my students at the university. I'm a good instructor because I boil things down to their most basics. And so what I've done is I've developed 2 courses, one specifically for someone that goes through the Beyond preceptorship and really wants to know how to support a Beyond physician. So that's kind of that protocol. But then the one that I'm doing virtually with the microscope, I broke that off into a separate course, and I call that Perio Max. And what it is it's maximum periodontal case acceptance by presenting the oral systemic connection. Okay. So, and I'm sure you're familiar with Dr. Bob Barkley back in the 70s. He was the most famous guy in prevention, and he went around the country talking about prevention. He was kind of a rock star, right? And he talked about facilitative learning and how do we get patients on board with what we're trying to do, right? You can't talk down to patients. You can't tell them, don't do this, don't do this. And so I'm really about bringing a patient along, and that takes time. That can't be done in one appointment. So what I did was I developed this Perio Max course. It's a 1-hour implementation. It's 1 hour. And so what I do is, once a person, I give people, I'm not in the microscope business, but I send people to where they can buy the microscope, correct? And then I send them the materials. And it starts with the patient interview. It goes through the medical history. I've got the hygiene scripts that talk about risk assessment and how you thread that conversation, because you need patients to choose a better level of care. You can't pressure them into that, okay? I'll give you a perfect example. How many times does a hygienist say to someone, would you like a fluoride treatment? And the first thing they say is, was that covered by insurance? And they say, well, no, adult fluoride is not. And then they say no. Yeah. So when you use risk assessment and Canberra, and you go through there and you say, you know, I've identified that you're at high risk for recurrent decay and all this, you know, work that the doctor's going to do, you're going to get cavities underneath here. What I would do if I was you, to be proactive, is that every time you come in and see me, I would get a fluoride treatment. So once you teach them about risk, and then you do the same thing with perio, you say, listen, you've got underlying cardiovascular disease in your family. And if I was you, you really need to be conscious of the fact that there is a connection between gum disease and heart disease and a whole host of other things. So we really need to get on top of this gum infection, okay? So it's a different conversation. So I supply all the scripts, all the products, all the protocols, all the insurance codes. And it's not a lot different than what people are doing, but it's like a toolkit, a complete oral systemic toolkit. The posters that you hang in the infographics for the room, because I want the entire operatory remodeled to become a wellness center. I supply that. I supply I've got some little animated videos that we show the patient. They're about a minute, depending on what their underlying health problems. And I'm telling you, I'm really having success with it, because it's not a grandiose, hygiene consulting thing where people charge $20,000 and try to engage you for a year. That's not needed. People know how to clean teeth. They know how to structure SRP appointments, but they just don't know how to integrate the education that pulls people in, which you already know because you've experienced the microscope.
Yeah, absolutely. And then when you have that first patient, and I think what really, really invigorates you as a professional is when you see them have that aha moment.
Yes.
And it really just, for me personally, I felt that, wow, like this is why I got into this profession. It wasn't like a run of the mill, like get them in, get them out, get them in, get out, get them out. Like you're really providing the best care for your patient.
Absolutely. And like I said earlier on, when the patient says, what are we going to do? And when are we going to get started? When was the last time you showed them anything where they said that, when they're asking you to get going? So it's a different deal. We need to try different paradigms. So for me to help dentists and dental hygienists incorporate a different approach, that's the foundational, because that was the question that you asked me. How do you get started? That's how you get started. Now, this other deal that I'm doing by finding a physician or a nurse practitioner, that's down the road. I mean, that takes time, and that's going to be a gradual thing. But what I want to show is that there is a model out there where, I can't even tell you how much I learned, how much I even learned this past weekend. I'm years and years into this, and I'm still learning. Yeah. And I see that holding events, screening events, are just giant gateways for education. If I held that screening event, like I'm not in clinical practice, I'm a managing partner in a practice right now. We are going to do these screening events here, and I just have to find the right audience.
Yeah.
I would fill a practice. I would fill a practice with really, really hungry patients by doing this exact same protocol. Okay.
Yeah. So tell me, what do you think is the biggest barrier to us in dentistry really getting to the place where medical dental integration is common practice and not something that is seen as new and up and coming?
That's the best question that's been asked to me. I can't even tell you in how long. What a tremendous question. The biggest barrier to me was like when I saw the Beyond method and I saw that it was straightforward, it was like, oh, I know what to do with that. The barrier is that no one has sat down and said, here it is, A, B, C, D. Everybody's talking at a high level about oral systemic, but nobody's breaking it down into do A, do B, do C. That's what I'm doing. I am so focused on implementation, and so is Dr. Pritchard. That's why when we got together in the spring, I said, I'm not out there teaching at a high level of convincing you that there is a connection. I want to show you exactly how to do this, because if you don't start having success and start making money, why would you do it? Okay.
Absolutely.
And so that's been the barrier, is lack of definition. Lack of definition, for sure. Great question though. Wow.
Yeah. Just hearing what you're saying here, I'm just like, that is going to be on the minds of some of the individuals. I was just giving a course. The topics that I speak on are related to HIV. So I speak on HIV, I speak on opioid addiction, and I also speak on diversity. And so I was speaking at a dental hygiene conference here at the Gaylord in August for RDH Under One Roof. Sure. And I'm talking, my particular topic is not on the reasons why we're dealing with an epidemic right now. It's all solution-based. Like, this is what you need to be aware of. This is how you identify an overdose. This is some of the strategies we can implement into our practice. And someone mentioned to me actually, this is not the first time, but someone said out loud in front of everyone, typically they wait towards the end. She said, how is this even possible? I just feel like this is impossible for us to be able to assess properly for our patients. And my response to her was, when it comes to the matter of saving lives, nothing is impossible.
Right.
So what I hear from you, and as you're talking, I can hear your passion. I can feel it all the way here in Maryland, although you're in Kentucky. And I think just when you have individuals that almost they're tapped out of what our profession is meant for, which is why I love the fact that you call it proactive oral wellness. We're supposed to be prevention oriented. Yeah. And I appreciate the work that you're doing. Cause it's
and I need to get dialed into your group too, like the RDH under one roof. I haven't yet, it's been kind of a progression for me because I've been, speaking to a lot of physicians and dentists and stuff, but truthfully, if you saw the hygienists that I've trained in locally here, because I'm coaching some locally, and now like the individual I took to Texas with me this past weekend, she's less than 2 years out of school. You have never seen anybody so on fire. I told her, I said, I've never, to me, it was an intimidating audience. These were all physicians and dentists, and obviously the laser users were some of the top guys in the business. Mm-hmm. And she's going up to them and explaining to them and taking their samples. And I'm like, that's remarkable. She's 25 years old and she's not intimidated. I would have been intimidated in her exact position, just like when a physician would come in for dental work, right? You're kind of a little bit on edge and whatever. And I was like, wow, if every dental hygienist could see the potential that I've kind of unleashed in this small group that I'm working with, they're just on fire. I mean, they feel like they have no limits. And that is completely different than someone that goes into a job and says, that's, you're expected to do 10 prophies and a prophy every 20 minutes or whatever. That's a completely different job.
Well, as you were speaking, I was thinking, you are the dental hygienist's best friend. They will love to work for a dentist like you. But I tell you this much, you have underestimated the power of the dental hygienist, Dr. Larkin, because let me explain why.
Okay.
Because we are the biggest cheerleaders and supporters and coaches that are out there that are ready to rally behind something as powerful as what you're doing. So I cannot wait for you to tap into our industry, because there are so many hygienists who are hungry for this, and they're probably, as they're listening to this, saying, oh my gosh, why can't I find a dentist like this that I can work with and support them so that we can care and save more lives? That's what we're trying to do.
For sure. Yeah. Help me get dialed into that, because I don't have that network, and and I'm very excited about that.
Yeah, definitely. All right. So, I try to keep my episodes short, but this was too good of a topic to cut short. So I do want to ask you one other question before we contact information and where people can find you. What was the best career advice you've ever been given?
Oh my gosh, the best career advice that anybody ever gave me. Just to stay relentless in the face of frustration. I've had periods of time where just nothing went right, regardless of how hard I worked, and just to stay relentless, And I see that with some of the young docs that I'm working with and young practices. I was taught that a long time ago. Just because you don't know where the breakover point is, and if you quit, you could be quitting right before the breakthrough. And believe me, when I'm talking about a niche that I've been talking about, there are times I don't feel like anybody's listening. So it's come in very handy the past couple of years.
Well, I hear you, Dr. Larkin. I do.
Yeah.
I love what you're doing. Please tell the listeners how they can find out more about POW Hygiene and the work that you're doing.
Sure. So powhygiene.com is the website, and everything's on there. I got, 65 oral systemic articles. I've got videos on the microscope, how to use the microscope. It's just all the educational surrounding this whole different way to approach dental hygiene. My personal email is tom@tomlarkin.com. Reach out to me with any questions or anything. And And I certainly want to network you a little bit to, to get into, to leverage my, as soon as you said that you had experience with a microscope, that just makes me crazy, because I don't find a lot of people like that. That's very unique.
Yes.
And so, yeah. And you need to see exactly what I'm doing for sure.
Yeah, absolutely. And there's another hygienist. I don't know if you know her name. Her name is Frances Horning.
No.
The topics that she speaks on are specifically what you're talking about.
Wow.
She's a hygienist that works with a microscope.
Yeah.
So
Well, if I can help implementation in just one way, in that, I've got an easier microscope that you can order online and set up in your office. If that was the only thing that I did, I would feel like I've helped the conversation a ton.
Yeah, absolutely. Absolutely. So we're definitely going to put all of those links in our show notes, and
Okay.
so that people can contact you. I think all of the work that you're doing is wonderful. And for listeners, Bale Domeen is spelled BALEDONEEN. It's the heart gene. I've seen it. I haven't read it, but I've seen it. And that's definitely something that I need to add on my list. So
I'm going to be seeing him tomorrow. I'm going to Chicago. They have an annual reunion, and going to Chicago tomorrow to be with them. So,
oh, wow, that's so cool.
Yeah. I'll be sure and tell them about this awesome podcast I did.
All right. Well, thank you so much, Dr. Larkin. I really appreciate you coming on to the show today.
Absolutely.
All right. Take care.
Okay.
Hey, BTP family. Thank you so much for joining the show. As a high-achieving professional, we have to remember that we should never stop learning. And that's why Beyond the Prophy offers the best CE that you can take from home or live in person. If you go to www.beyondtheprophy.com, under our events tab and under live CE webinars, you'll see a host of topics we cover, such as air polishing, working and managing the autistic population, medical marijuana, periodontal endoscopy. The list goes on with what we offer so that you can provide the best care for your patients. Beyond the Prophy has taken the time to become AGD PACE CE provider and an AADH CE provider. So stop on over. Come on and learn with us. We can't wait for you to join us. We will continue to serve you with excellence, and we'll see you next time.